The Kanyinya Center was the first location in Rwanda where COVID-19 patients were first cared for and for the longest time had no critical cases, but no more because this is where the sickest patients are brought in a fight to keep them alive. The first room we were allowed to visit had a patient so sick they were not even aware of our presence and needed a ventilator to do the breathing for them, while doctors constantly monitor their condition. This machine draws in air and pushes it into the patient's lungs, helping them to breathe. On this display, I can monitor my patient's heartbeat, currently going at 100 beats per minute, blood pressure of 126/83, blood oxygen levels of 93, and they are taking 30 breaths per minute. Those are the current figures I have on the patient. Other critically ill patients that are able to speak have dire warnings for everybody else. This is the first time I have truly been sick in my life. I had never even gotten malaria. Therefore, no one can say that they are so strong that they are immune from this. It attacks everyone. Others now recovering, but came to the brink of death, say their first mistake was thinking that they had typhoid or malaria and not COVID-19, which caused them to seek treatment late. Something they say they now seriously regret and call on others not to be so careless. I coughed so much, I passed out. After 3 days, they told me that it was COVID. It is a terrible disease because it literally strangles you. You start coughing, and the more you do, the less you can breathe. What can I tell you? Before all this, I was so healthy I had never gone to hospital to get an injection. COVID-19 changed all that. No one should play around with this because it is a terrible disease. Delay to get treatment just a bit and it will kill you.
Tariki 19 z'ukumunani niho bambwira ko mfise COVID.
On the 19th of August, I was told that I have COVID. At first, it was hard to accept, but I had to eventually. I have a constant cough, and when I can't breathe, they help me to do so. People should know that COVID is a killer. COVID-19 has killed 7 people in Rwanda in the last few days, less than 2 weeks, and health officials fear that it could kill at least 25 in the next month at this rate.
Rero niba umuntu ahitamo kujya kwandura indwara tukazamusanga mu ndembe.
It is not right that people should willingly expose themselves to this disease only to end up in intensive care. Anyone can protect themselves until we get a vaccine, and there is confidence that it could be available soon. People should be patient and continue practicing the preventive measures in place and obeying the directives given. People should not seek pleasure and risk losing their lives. Seek profits in business and forget the most basic COVID preventive guidelines.
Aho gushaka gucuruza no kuronka bituma bibagirwa amabwiriza y'ibanze yo kwirinda COVID.
With a vaccine or cure for this strain of the coronavirus yet to be found, health experts around the world have continued to advise people to wash their hands as many times as they can, wear masks, and practice social distancing.